Imbalances in the pelvis must be identified and addressed, as they can cause distortions in the feet that will lead to pain and dysfunctional movement patterns. Such imbalances can cause an internal rotation of the thigh, which causes a torsion of the knee joint and often leads to collapsing arches in the feet. The reverse may also occur. The arches may collapse first. This will create a torsion on the knee joint and lead to an imbalance in the pelvis. Whether the dysfunction began with the pelvis or the feet, a whole body therapy program must be administered. In order to correct the position of the pelvis, normal tone must be restored to the adductor muscles of the inner thigh. These are the muscles that commonly pull the knee joint inward, causing a knock-knee posture. It is essential that the entire length of these muscles be released. Also, the quadriceps, the muscles of the front of the thigh, must be released to restore proper position of the pelvis. These are some of the muscles that tilt the pelvis forward, which often cause the head to translate forward. This process shifts the majority of the weight of the body from the heel to the front of the foot. This can also lead to tightening of the muscles in the low back. As the erector spinae span the entire length of the back and neck, tightness in this muscle group can affect the position of the pelvis and the head. Precise treatment of the layers of muscles in the feet will reduce foot pain caused by entrapment of the nerves that pass through and deep to the muscles. Strengthening exercises and orthotics may be necessary to incorporate during the rehabilitation process in order to rebuild the collapsed arches.